So we're here in our rehab department, and it's actually a very extensive facility. We combine physical therapy, occupational therapy, patients for mobility and activities of daily living, which is basically the self-care activities that are needed for patients to be able to go home and take care of themselves. And so mobility is a big part. Parallel bars right here, they can accommodate various sizes of patients because they can move up or down, in or out. We can move a wheelchair in with the patient so that the therapist can be right behind them with the wheelchair. And so that also helps with the transition from any sort of upright activities. We can start, if you want to take a look way over here. I don't know if you can see back in the corner, there's a table. We call it a tilt table. I call it kind of like a Frankenstein table. And so we tilt them up. When a patient's been at bed rest for a long time, they lose their ability to tolerate being upright. And so that's the first thing we would start them with. We start them sitting at the edge of the bed in their room, but then we also need to get them tilting up and tolerating being upright as much as possible. We get them to that point of where it's kind of their oh no reaction, and that's actually when the adrenaline kicks in, and that helps with that process of being able to tolerate being upright more also. So.